We're back here on the Lynn Hayes Freeland Show. I told you we were going to start off kind of celebrating, having fun, but now we got to get down to some serious business. Richard Garland is back. You know, you started coming on this show with One Vision, One Life. Now you're at the University of Pittsburgh Graduate School of Public Health.
Ooh.
But the issues are the same, Richard. It hasn't changed.
And they're not changing. I mean, we can look at the work that I started with One Vision, One Life. You know, I can tell you that there are many guys that have changed. They're tax-paying citizens because of what the whole model of One Vision stood for. And actually, we was doing a public health model when we was running One Vision, One Life. We just didn't realize
I was going to say, without it being called a public health
without,
model.
right. You know, so
let's explain for at least some of our viewers who may not be familiar with One Vision, One Life. What was it?
So I went to the problem for the solution. I had formerly incarcerated men and women working for me. They were former drug dealers, former gang members. Those were the men and women that kids were following in their footsteps. So what I call is flipping the script was that we changed their identities by when these men and women went to talk to these young people who they thought that they was following in their footsteps, and they was telling them, now go to school, listen to your parents.
We're saying, no, you don't want to go this way.
You don't want to go this way. This is the way that you want to go. So, you know, fast forward to the day, we look at them as interrupters. So when we look at this violence as a disease, we look at interrupters as they interrupting the transmission of the disease. And then the second thing is we really want to change community norms. You know, one of the things is I look at a lot of the violence that's going on in our community, in the African American community, you know, as a disease that as we interrupt that transmission, we have to try to treat the disease, you know, through opportunities, you know, jobs, school, you know, getting folks out of this drug and alcohol, you know, stuff.
So it's similar. I have a friend who used to always say, if I'm driving in traffic and if I'm driving down the road and I see traffic ahead, I'm going to call you and say, don't go this way.
Right.
Because the traffic's all backed up.
Right.
It's the same kind of thing.
It's the same concept. It's the same concept. But, you know, here's where my frustration is, and to me and others who are doing this work, it's insulting that a lot of the work that we do isn't really recognized. You know, funding is always an issue. Me being at Pitt right now, and I have 3 people working with me. It's 3 of us. 3 of us to cover all of Allegheny County and the city. I have to work closely with people. People call me all the time, trying to get in front of things that might be happening in the streets and stuff. You know, because a lot of people don't want to do a lot of the things that they're doing, whether we can tell them that they're being forced to do it. You know, it's the climate of what the communities that they live in.
And they don't know how to get out.
And they don't know how to get out, you know, and a lot of people don't understand it. You know, I mean, what is even really, we look at this horrific event that happened at the Tree of Life. We look at all the millions of dollars that's been poured into that. We look at every time we talk about a mass shooting that's not in the communities that we in, but in the African American community or the Black and brown community, every day there's a mass shooting. Every day that people are traumatized, that they, you know, somebody got shot. And right now we're back to where young African American males are being shot.
And I feel like, and I said this to you in an earlier conversation, I feel like every morning I turn on the news, and there's another 1 or 2 shootings, and we're not even to summer yet. In my mind, it always gets fired up or whatever during the summer.
Yeah, people start seeing people where they didn't see them because everybody's out. Everybody's out, you know. And people will probably say this as an excuse, but you know, it's the conditions that people are living under. There's a lot of opportunities for folks here in Allegheny County and throughout Pittsburgh But are we taking advantage of those? You know, I still have faith in this younger generation. I still have a lot of faith in this younger generation. But they need the elders to really embrace them. I don't think that a lot of people have embraced our youth like we should,
I
like
think a
we
lot-
were
yeah.
embraced.
I think some people will tell you they're afraid.
Right.
And
Right.
that may be misplaced to a large extent.
Right. I mean, it's because of, you know, I always talk about how impulsive people are today. You know, how many times do you hear about people in cars, you know, being angry at somebody, just getting up and shooting? Like we had a shooting where a truck driver,
Right.
you know, shot. That's impulsive. How impulsive people are right now. You know.
I've had that feeling a couple times in driving.
yes.
That's why I
Yeah,
can't have a gun,
yeah.
because I've had that feeling.
But it, you know, it's legitimate. I mean,
So what do we do, Richard? I mean, because clearly, like One Vision, One Life went away because of a lack of funding.
right.
There's money out here, but are we spending it? I don't want to knock like the shot spotters, but we're spending it on other things.
We can't police our way out of it. We like I'm always gonna say we need law enforcement. We do need law enforcement, but we can't police our way out of it. You know, things like shot spotter and stuff like that. They get there. You know, I see the gunshot wound victims that come into the trauma units. You know, they're getting younger again, and these guys don't even want to say anything about, you know, what they're into. You know, it's really trying to get to the root of the problem. You know, I'm still hearing from guys that's been shot that they still waking up with nightmares of getting shot. You know, they haven't moved from 2 years ago getting shot. You know, so
Would that be like a post-traumatic
that's
stress?
post-traumatic stress. You know, are they getting the proper care that they need? In a lot of cases, they're not. And then there's some that
Because
they're reaching out.
we're not necessarily talking physical.
We
Some
talking
of it
about
is gonna
mental.
be- yeah.
Yes,
okay.
we talking about that mental thing where they're not sleeping at night. You know, they relive that trauma every day. You know, and then they feel stuck. People feel stuck.
I mean, saying if you're walking around carrying that trauma with you,
Right.
you're constantly looking over your shoulder.
Right.
You're feeling like you got to be prepared in case something happens. So it's kind of like a treadmill. It just doesn't
Right.
stop.
It's just like you said, that guinea pig running in that treadmill.
Yeah.
Yeah.
And it just doesn't stop. And then it becomes generational.
Yeah, and you know, I'm not saying all this like it's hopeless. You know, I believe
That's
in
good because you got a minute.
Yeah,
to
I
bring this
believe
back
in
around.
what we done with One Vision, One Life, and what we trying to do to interrupt this transmission of this disease. But people got to get behind this disease just like they get behind tuberculosis, cancer. You know, this disease is the most underfunded disease there is. And some people will not even look at it as a disease. But we have to look at all the things that, you know, add to this disease. You know?
Well, and you know what they say, disease is dis-ease.
Right.
And you have to break it down. Richard, we
Right.
can talk all day, but
You
you
know,
just have to come back.
I'm always willing.
There you go.
know,
There you
I'm
go.
always willing. You know, there's a lot of young men and women out here that's still trying to, you know, combat this disease.
And make a difference. There you